Hi everybody, I'm Jenny Sprung. I'm a neurosomatic massage therapist. I am also a trigger point massage therapist, zero balancer, and also a fitness and nutrition enthusiast, researcher. I've come up with quite a few home treatment options for my clients and my patients. You all have all of these at home. I'm sure you have an old racquetball or an old lacrosse ball. You've probably got a couple of these little massage balls, a dryer ball, or even a tennis ball. I want you to find them and bring them on over here so we can work our sacrum to decrease low back pain, sciatic pain, glute pain, attachments into the sacroiliac joint, as well as the quad attachment into the ilium and the greater trochanter, hamstring work. So here with the model, you're going to see that you can use any of these balls, and it just depends upon how sore you are, which one you're going to start with. I would start with a softer ball. You can go right in between the ilium and the sacrum. Okay? All through the sacrum and all around the glute. In through this area, hamstring attachments, and all around the tensor fasciae lata. Now we did the TFL, the tensor fasciae lata, in a previous video. So look it up on YouTube or on my website. Website is treatyourselfnaturally.com, .org, .net, and all of those, .info. So once again, choose your ball. Modify it if you've never done it before. Start with a softer ball, a tennis ball or a racket ball. If you think that you need some more muscle, use a lacrosse ball. So I will show you the positions, and I'm going to use the tennis ball, because most people have one of those. I'm going to sit on your mat. You bend the knees up and lie down. Arms at your side, neck relaxed. Take a nice deep breath, lift up a glute, and place the ball on one side of the sacrum and come up on it. Use the arms as stabilizers, the feet as directional stabilizers, and go into the sacrum. Find a spot just where the lumbar spine meets the sacrum, and go back and forth or around. You can come up into L5, the last lumbar vertebra, and go into there. Take 2 or 3 deep breaths and let the trigger point relax. See if you can feel the energy going through the whole body as those very strong muscles start to relax. You can lift up a little bit higher, do a bit of a bridge, and go to the other side and go into that sacrum, into the ilium, SI joint, and roll around. And some folks are going to say, well, where am I going with this? Where's that ball supposed to be? It's not up in the waistline. I don't want you to go up there for the sacrum and the glute. It's down a little bit further, and I'll show you on the model again in a minute. And once you get both sides real good, then you can go into the glute. And here you're going to turn to your side a little bit and go into the glute medius, which is a great contributor to sciatic pain. You're going to move that leg down and open it up a little bit. You can move the leg any way you want till you can get the muscle that you'd like. And you really are going to turn to your side. The upper arm can come off the floor, and you can just lean on that ball. You may want to try this in the bed first. Have a softer surface than a tile floor, wood floor, or cement. So I'm going to come back to center, lift up, remove the ball, and show you on the model again where I'd like you to go with it. Avoid the tailbone. You can do S1 to S5. Sacrum 1, 2, 3, 4, 5, all through here. You can go right on the spine of the sacrum and then roll to the other side. This is your sacroiliac joint, right in here. Go right in the ilium and up right into this really yummy spot right here. Taking 2 or 3 deep breaths, holding, and then getting out of there. Never want to use the ball too long in an area because you'll leave yourself more sore. All right. Stay tuned for the next one, and thanks a lot, everybody.